Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Today, our conversation is about knowing your options when it comes to Medicare. The annual enrollment period begins on Friday, October 15th, and we're going to break it down for you for who it's for, what's involved, and how to get it done during this almost 8-week period. Get your pen and paper ready. You're going to need it. Joining us now is Andy Stansfield. Andy is the founder and lead agent for Stansfield Health and Life, and is all about helping people to understand insurance while making the best decisions for you and your specific situation in life. Andy, welcome to the show. I like that about your specific situation in life. So we're going to touch on that. But first, give us a little background about yourself.
Sure. Thanks, Michelle. My name is Andy Stansfield. I own Stansfield Health and Life, a health insurance agency here in the Jacksonville, Florida area. I basically help anybody out there who is looking for health insurance options, be it whether they're on Medicare, whether they're not old enough for Medicare yet and are not covered by an employer out there. So basically the only people I can't help are people who already have a health plan through a job of some kind.
Okay.
I can also help employers who are looking to give health insurance to their employees, but I deal with a lot of individuals most of the time when it comes to their health insurance decisions.
Yeah, and people have very different situations when it comes to deductibles and kids and planning for families and everything. But let's hit on this first topic. Every year on October 15th, doesn't matter if it's on a Friday or a Saturday or a Sunday, right. October 15th opens that window for the annual enrollment period, or AEP.
Correct.
So break that down for us. Why October 15th?
Good question about why October 15th.
Right. Oh, I know why. I bet it's because January 1st, all the benefits go into effect.
Yes. Yeah.
Okay.
Yeah. Okay.
See, we solved that problem.
Definitely a way to put it. Yeah. The insurance companies need some way of kind of categorizing and getting all the information they need in order to start somebody off on January 1st. So yeah, the open enrollment period, October 15th through December 7th. And this is the time for anybody, and this is specifically for people with Medicare, this particular time frame. It's their opportunity to change, switch, or even drop their current, what's called a Medicare Advantage plan or prescription drug plan. Or they can pick up one of those plans if they want to at this time, if they did not find a way to do that somewhere else during the year or when they first turned 65.
So when you're 64.7 or whatever it may be, what is just Medicare? Like basic, this is what I get when I turn 65, Medicare.
Yeah, no, great question, because everybody gets the same thing, and everybody, for the most part, pays the same thing for it. So you'll hear a lot about Parts A, B, and C, and D, and everything. The original Medicare is considered Part A and Part B. And really all that is Part A are essentially hospital services. I like to call them overnight services. And so if you go into the hospital will send the bill to Medicare Part A to pay that bill, and anything left over that Medicare does not pay is up to you, the patient, the person. Medicare Part B, those are for services that are usually doctor visits or x-rays, labs. I like to think of that as like a same-day type of a visit. If you're going in and coming out the same day, there's probably a Part B service, and so that doctor or x-ray lab, whatever, is going to send their bill to Part B. Medicare will pay their portion, and whatever portion is left over for you to pay based on Medicare rules will come to you in a bill. When it comes to costs and everything, if you've worked in the United States, you're going to have Medicare Part A typically paid for 100%. You need to work about 10 years, pay Medicare taxes. So when you're looking at your pay stub, Medicare taxes, that's what it's going towards, is a fund to help pay for Medicare Part A for you once you turn 65. For Part B, it's not something you have to have. It's highly, highly suggested that you do have Part B, but you don't have to. And in that case, when you do have Part B, you are charged a monthly premium, just like car insurance, just like any other type of insurance out there. There's a monthly premium. Right now, 2021, it's about $148. It's going to go up a few dollars here in 2022. Everybody that's on Social Security will get that notification, and that is typically pulled out of a Social Security check. So that pays for your Medicare Part B. Beyond there are other costs to be concerned about or to know about. On the Part A side, remember hospitalizations, overnight type stuff. There's a deductible. Deductibles are just like a car insurance. You have a $500 deductible in your car. You wreck your car, you pay $500, and then the insurance company starts to pick up the rest, or they start helping from there. So in kind of round numbers, that number is about $1,400 for Part A. So you go into the hospital, the first $1,400 is essentially up to you. It's like $1,430 something, round numbers.
Yeah, they couldn't make it easy.
No, of course not. Yeah, because it has to go up every
right.
So at that point, what this does is this covers you for a period of 60 days. You have a 60-day window of time. You can go in and out of the hospital. That first $1,400 is up to you. Now, if you come out of the hospital and then 90 days later you go back in the hospital, guess what? That's another episode of care, and that's another $1,400 deductible. If you're in the hospital longer than that, then Medicare comes back and says, well, we need a little bit more money from you because we've really been putting in a lot of money towards your hospitalization from there. So that's kind of the Part A. Part B, a little more simple than that. There is a deductible as well. It's about a little over $200 a year. So essentially the very first doctor visit you go to will probably take up most of that first $200. After that, they go to what's called an 80-20 split, in which case Medicare will pay 80% of all doctor bills and you pay the other 20%. And that's Medicare. That's what you get. Everything else has to be added on after that, but that's what you get when you turn 65.
So basically, an individual, what they're looking at out of pocket for just a regular Medicare, any illness or anything happens, maybe $1,600 deductible.
For $1,400, and that's only if you're hospitalized.
Only if you're hospitalized.
Yeah,
okay. See, I find it extremely confusing. Andy Stansfield is our guest today from Stansfield Health and Life, helping us breaking down on the Medicare. So Medicare A and B is pretty much the standard
Correct.
that you get. And then there's other add-ons. I mean, what if I take prescription drugs and by the time I'm 65, I might still be taking, some prescription drugs that I was taking when I was 64. Right. So what are we looking at and keeping those costs down?
Sure, of course. So to address prescription drug costs, Medicare came up with something called Part D. D for drugs is the way I call it. Very easy to
totally
think about
works
it that way. Part D, and essentially this is just an insurance policy. So Medicare has gone out and they've asked private insurance companies to put together an insurance plan that more or less gives you better pricing off of the retail cost of a particular drug. So you might have a high-end branded medication out there that might be cash pay $500. Well, if you have a Part D drug plan, that Part D drug plan has worked it out to where now you may have just a copay of, say, $35 or $47 for that particular medication. And without that Part D plan, you're kind of in the boat of having to pay full retail. So that's how Medicare has addressed the medication cost by saying, you don't have to get one, but it's highly recommended if you are ever going to have any type of medications that are relatively expensive. A Part D plan is a very good thing to have. And also what they do is, as a little more incentive to get one right away, is if you do not get a Part D plan when you're supposed to, basically when you turn 65, when you go on Medicare, and say you wait a couple of years, I don't take medications, I'm fine. 2-3 years down the line, you get prescribed a medication. Whoa, it's a $500 medication. How am I going to do it? Oh, I need to get a Part D plan and it'll all be good. Well, you were supposed to get that plan back when you're 65. And now they will attack a penalty on for every single month that you haven't had that plan, and you will pay that penalty in addition to whatever that plan costs.
So like you're being retro-charged?
Mm-hmm. Yeah.
Wow.
It's just to help the insurance company avoid people from just jumping in whenever they need it, kind of thing.
Right. And so Part D isn't something you can add during the annual enrollment period?
Yes, you can.
Okay.
It's called a prescription drug plan or a Part D plan. So the annual enrollment period is a time where you can pick one up, you can drop it and switch to another one. If you think about it, throughout your lifetime, you might change medications throughout time, or generics might start, or a new brand comes out and you really want to take advantage of something like that. But your particular drug plan at that time doesn't help pay much for that, or doesn't cover it as much, or it's not part of their list of approved medications. So every year you have the opportunity to look at all the other companies that offer Part D plans out there and switch to one that's more favorable to your particular situation.
And are you still penalized if you're adding it during that annual enrollment period?
No. What you essentially, the very first time you go to get a Part D plan, essentially it has to be within the first couple months of you turning 65.
Okay.
If it's not, then they assess the penalty. Otherwise, every year you have the opportunity to change or stick with it or drop it if you want to, but most people don't.
Yeah, that totally makes sense. Yeah. All right. Well, our conversation right now is with Andy Stansfield with Stansfield Health and Life, and we are breaking down Medicare for you today. And coming up in our next segment, we will continue this conversation because we got a lot more we can talk about. That we're only at Part A, B, and D.
Right.
So there's plenty more to cover. So you'll definitely want to stick around. The conversation will continue. Inspiration Health Radio, sponsored by Millennium Physician Group. We'll be right back.